Understanding your child's kindergarten immunizations. This presentation is by me, Amanda Schrader, and I am a nursing student at Indiana State University. Learning objectives. By the end of this presentation, you should understand what routine immunizations your child will receive, understand what protection your child will receive from Dtap vaccine, understand what protection your child will receive from Mmr vaccine, recognize what protection your child will receive from varicella vaccine, understand what protection your child will receive from IPV vaccine, recognize what protection your child will receive from hepatitis A vaccine, and what protection your child will receive from the hepatitis B vaccine. At this time, if you'd like to click out of the presentation, there's a pre-test that you can take to assess your skills prior to the rest of the presentation. Some facts about immunizations. Infants have temporary immunity from antibodies passed on from the mother in utero. Immunizations create immunity by exposing the body to small amounts of a killed or weakened germ that causes disease. Vaccines stimulate the immune system to react as if a real infection were present, and then imprints memory of the infection and can fight back if the germ enters the body again. The American Academy of Pediatrics recommends combination vaccines when possible to lower the number of shots that the baby receives. Vaccines are safe with mild reactions. The risks are small in comparison to the risks of getting the disease. Also, vaccines do not cause autism. Diphtheria is part of the Dtap vaccine. Diphtheria is a serious illness spread through droplets through cough or sneezing. Symptoms include a fever, a sore throat, a thick coating in the back of the nose and throat that can make it hard to breathe or swallow, especially for infants and toddlers. This illness can also affect the heart, leading to abnormal rhythms or heart failure. 1 in 5 children under the age of 5 who contract diphtheria die. This vaccination does not offer lifelong protection, and boosters are needed. By kindergarten, the child should have 5 Dtap vaccines already in place. The Dtap vaccine also provides protection against tetanus. Tetanus is caused by a toxin that is made by bacteria and enters our bodies through a break in the skin, such as stepping on a rusty nail. It does not spread person to person. Symptoms include lockjaw, muscle stiffness, stomach spasms, headache, fever. It can also cause problems with blood pressure or heart rate. The spasms in the muscles can be so strong that it can break bones in the child's body. It can take months to recover from a tetanus infection. 1 in 5 diagnosed with tetanus die. Dtap also provides protection against pertussis, which is a serious respiratory infection. Symptoms include violent bouts of coughing, runny nose, apnea in babies, or pausing in their breathing. It's also called whooping cough because the sound that the baby makes as they're gasping for breath makes a whooping sound. The cough can last up to 10 weeks. Death rate in those that are 2 months old or younger is 7 in 10. So 7 out of 10 babies that get pertussis die. Pregnant mothers can be immunized during pregnancy and help pass some protection to the infant in utero. Pertussis is transmitted in the air through coughing, sneezing, or even breathing. Before vaccination in the U.S., there was about 8,000 cases, 8,000 deaths per year, and now there's less than 20 deaths per year. IPV, or the inactivated polio virus, protects against polio. Polio is a life-threatening disease. It's a virus that can infect the spinal cord, leading to paralysis. Polio attacks the nervous system in the body. Most people that get polio won't have symptoms, or 1 in 4 will have mild flu-like symptoms: fever, sore throat, fatigue, headache, nausea. Children less than age 5 are most affected by polio. 1 out of every 200 people with polio end up with some form of paralysis. Even if they fully recover from the paralysis, it can develop again later in life. The U.S. has been polio-free for 30 plus years thanks to vaccinations. Polio does still occur in other countries around the world, and is very contagious and can be passed through droplets and through touching feces and then touching the mouth, nose, or face. Measles protection is provided through the MMR vaccine. It's also known as Rubella. It's a serious respiratory disease with high fever, watery eyes, nasal congestion. There's a rash that follows 3 to 5 days after symptoms begin. The rash is flat red spots that usually start on the face or around the hairline, then spreads down to the trunk and the extremities. Very contagious. It's dangerous for infants and young children. Usually 1 in 5 kids that contract measles end up hospitalized. It's so contagious that you can become infected just from walking into a room where an infected person has been. That virus can be in the air for up to 2 hours after the person has been in the room. Mumps protection is given through MMR. This is a virus that's spread through direct contact with saliva or respiratory droplets. Before the vaccine, this was the most common cause of deafness and meningitis. Symptoms include puffy cheeks, swollen jaw, mild fever, headache, aches, fatigue. Serious symptoms include deafness, meningitis, and encephalitis. Protection against rubella is also included in the MMR vaccine. Rubella is also known as German measles and is rare in the United States. 25 to 50% of those infected with rubella will have no symptoms at all. Symptoms typically include low-grade fever, cough, runny nose, aching joints, pink eyes around the conjunctiva, and rash. The rash usually starts on the face and then spreads downward. Chickenpox protection is provided in the varicella vaccine. Chickenpox causes an itchy rash with blisters. Other symptoms include fever, headache, fatigue. Usually symptoms last about 1 week. One child can have up to 500 blisters on their body from this. Before the vaccine, about 4 million people in the U.S. Contracted chickenpox each year. It's highly contagious and spread through droplets. Hepatitis A vaccine is another vaccine that your child should receive before kindergarten. This vaccine can help prevent hepatitis A, a serious liver disease. Symptoms of hepatitis A include fatigue, decreased appetite, abdominal pain, and jaundice. These symptoms can last several weeks, but most make a full recovery with no liver damage. The person can transmit hepatitis A without ever having any symptoms. Most children under the age of 6 have no symptoms at all when infected with hepatitis A. The Hep B vaccine gives protection against hepatitis B, which is a virus that does attack the liver, spread through bodily fluids such as blood, semen, or saliva. There's acute hepatitis B or chronic. The acute is short-term. Usually the symptoms just involve a fever, decreased appetite, jaundice, fatigue, or nausea. Chronic infection will be lifelong and could lead to liver failure or cirrhosis or scarring of the liver. In conclusion, vaccines are safe, effective, and help prevent these serious diseases in our children. Vaccines keep children healthy and in school learning. By the start of kindergarten, your child should have 5 DTaP vaccinations, 4 IPV or the polio vaccine, 2 MMRs, which cover measles, mumps, and rubella, 2 varicella, which is the chickenpox, 2 hepatitis A vaccines, and 3 hepatitis B vaccines. Thank you for joining this presentation. If you'd like to click out, you can take the post test to see what you learned.